Hi, everybody. This is Cindy Kennedy, and we are listening. Well, you're listening. I'm recording, but you're listening to another episode of Living with Lyme. We have Dr. Jaquel Patterson from Fairfield, Connecticut. She's a naturopathic physician. She is a treater of Lyme, pandas. She is into anti-aging. She has a very impressive biography. So please go to the website www.livingwithlyme.us and read all about her. Because it's so impressive, I'm going to let her give us some some info on it. Dr. Patterson, welcome to Living with Lyme. How are you doing today?
Good, good. So glad to be here and be able to talk more about Lyme disease because it's a much needed conversation. And as you said, I'm a nationally recognized naturopathic physician. I've been practicing for over a decade, and Lyme is probably around, I'd say, 70% of my patient base. So we also in Connecticut, where it was first identified. So we actually see many patients with that. I'm very, very active on the leadership front. Also currently serve as a president for the American Association of Naturopathic Physicians, and also on the current board for Connecticut Association for Naturopathic Physicians. So have spoken, nationally and also internationally, actually, as of next year. And just looking forward to talking more and providing education information about it.
I read in your biography you were asked to be on Dr. Oz.
Yes, to talk more specifically about cold and flu, actually.
Okay. Yeah, I mean, that's a problem too,
exactly.
Isn't it?
Especially now at this time of year as we're preparing up.
And I think you must get hit so much harder with viruses when you already have a compromised immune system and you're fighting the disease like Lyme disease.
Yes, and I know we're going to talk more about that, but those are the pieces that I'm always trying to manage once a patient does get well. It's usually stress, it's illnesses, cold and flu. Those things are common triggers. So, how do we kind of get through that to be able to prevent that uptick of that aggravation with Lyme disease? So maintaining your immune system is like huge.
Right.
As part of managing your care for Lyme over the long term.
Right. And hormones, because you've got that dysregulation of the HPA axis, which is the hypothalamus pituitary adrenal, for anybody who doesn't know HPA.
Yes.
Yeah. So that's a real, that is a struggle, because I think once you become so compromised and you shift over to that sympathetic nervous system reaction, as well as that vagus nerve that gets involved, we end up really struggling.
Yes, and then also, with Lyme disease, there's a lot of inflammation too that it causes. So what you'll see for some of the patients I have, they'll start having symptoms that they've never experienced before, like anxiety, for example. Anxiety more so than depression, and a lot of times it's because of the inflammation to the brain that causes that effect in terms of the neurotransmitters being able to work in the way they normally do. And so they'll start being some of those like changes in terms of mood changes or anxiety that a person may have not experienced before. And obviously having the illness too and all the symptoms that come with it are also anxiety provoking as well. So it's kind of coupled all together.
Right. And that's probably where some people experience irritability to the point where their emotions, they can't control it. You've heard about people that have a lot of rage when they're sick.
Yes. And I see that also when patients get on treatment. I'll have patients that have went on antibiotics and they'll start getting, Lyme range because they're having that herxing reaction sometimes when they're on a treatment plan. So I will see that as well. But the interesting thing, I think, when I first started working and seeing patients with Lyme disease were the people that came in that had said, I've never had anxiety. I see something over there.
Yeah, that's my kitty. He's interested.
Wanted to make an appearance.
Yeah, we've had all of them.
I love it.
Yeah, they're too cute. They're too cute.
But so in terms of, but a lot of the patients that I would see when I first started working with Lyme disease said like they've never been an anxious person, or they've never been moody, or they've never been depressed. And it just kind of came onset with the other, with actually getting diagnosed. So that's what kind of, made me look into that as part of it, because I found so many people coming in, particularly people that were younger, because it just kind of came out of the blue and they never had those symptoms before in terms of the psychological effects.
And, the majority of your neurotransmitters are produced in the gut. So do you think
Yes.
they've come, or they've ended up initially having a very compromised microbiome?
That's a really good point, because it's around, I think it's somewhere 60%, somewhere in terms of percentage for that whole gut brain connection. And there is definitely a connection with a lot of your neurotransmitters, particularly like serotonin is one of the largest ones in your GI lining. So you are right, there's specific gut microbiome that help with a lot of chronic illnesses, including some of them help in terms of probiotics to help with even things like mold. So if that is definitely weaker, you're going to be more susceptible to having some challenges with neurotransmitters, but also your immune function. A lot of your gut, the strength of your gut is a reflective factor for your immune system. So that all kind of comes all together as a result of it. So it is also immune system, like you, and also the neurotransmitters, which you had mentioned too.
So what is your approach to
Mhm.
patients who you consider a possible Lyme sufferer?
Mhm. Well, a lot of the patients we see, I get kind of a mix. Unfortunately, it's rare that I get patients that it's their initial diagnosis. Oftentimes, they've unfortunately been suffering with chronic Lyme disease for a period of time, have went the antibiotic route, where they've taken that for several years and kind of still feel the same. I've had patients, many of them on IVIG. And a lot of other treatments. So typically my first approach, so it depends kind of where that patient is coming in. If it's like there's symptoms of that acute onset of like fever or joint pain, not everybody, as we know, gets the erythema migrans in terms of the rash. It's only about 50%. So a lot of people do not get that. But they might get other things like striae, which is connected with Bartonella. And so what I'll do is I'll initially check for Lyme disease and all its co-infections. So I like to check that because oftentimes that whole full cadre of blood work has not been checked. Also, I want to rule out any kind of, like, let's say, autoimmune conditions that could also be factoring into it. And I have had that where some patients have more, might have lupus or a different autoimmune condition. But Lyme is known as the great imitator, right? So it does mimic a lot of other disease conditions. So I have to be mindful of that. So I first evaluate that piece. Typically, if it's like full-blown onset of Lyme, they just got it and all the symptoms, I might have to get them, obviously prescription or something like that, because that's at the best time that actually works. So we would have to refer them out for that. But typically, it's usually an herbal protocol. Modified Cowden is one that we use pretty frequently in the office. Dr. Zhang's protocol, Beyond Balance, Bunner's. There's a lot of different protocols. One of the other things we have in our office, which is specialized, is something called low-dose immunotherapy, which basically has the different viruses like HSV, Epstein-Barr, but we also have Lyme, Bartonella, pretty much all of those. And so we'll usually use that for a patient that has more of the chronic, more like that autoimmune related piece. But there's only a handful of providers really on the East Coast that are trained on low dose immunotherapy, actually nationally. So we would look at that as well. And then I could probably talk forever, but the approach, it's a bit of a mixed approach. I'll look at antimicrobials, but it also depends on the person, because some people cannot do that right away. I'm always doing that, plus I'm doing something to support their, like the mitochondrial functioning in terms of like CoQ10, B complex, and looking at those things. But then I also want to do something in the back end to support their immune system. For some patients, the immune system support might be the first thing, because they might not tolerate, the antimicrobials and things like that in the beginning. And so you really have to, and that's a good thing when you work with a naturopathic doctor or just functional medicine provider, you have to make it really unique to that patient. I have some patients, I put them on 1 drop of something and they're herxing. And then others, I could put them on 30 drops and they're totally fine. So everyone is really uniquely different depending on how it's presenting for them.
I think a lot of the Lyme doctors, especially, I can relate to that for myself, did not really provide information or assistance with detoxification. So it's one thing about changing your viral load or your spirochete, bacterial load, etc. But if you don't help them process that, is that another thing that you immediately work on?
Yeah, so some of my individuals, or some of the patients we have will have issues with like phase 1, phase 2, then there's, phase 3 in terms of elimination. And when I see that the most is those people that are sensitive right away. You do one thing and they're sensitive, they react. So with those, I usually have to put more on things like liposomal glutathione and NAC, and I might do those things before I even provide the protocol with them, because I need to make sure their emunctories, their organs, their detox processes are all working really well and smoothly before I put them on a protocol. And then I have some people, they'll be doing well, and then all of a sudden 4 months in, they're getting like nauseous, so they're just not feeling well. They're getting some of these like aggravations. And then I'll find that if I put them on some of these things, they'll do better. Or my test is I'll just hold them. I'll say, okay, let's take a holiday for 3 to 4 days, and they'll feel better. And so usually to me, that indicates there's this toxic burden that they're unable to just kind of get rid of stuff out of their system. So it actually gives a lot of good information, because if they're feeling better a few days after stopping, it's oftentimes it's too much for their system and you need to kind of slow down. So that's a part, I think you're right. A lot of doctors, even people that are Lyme experts and literate, do not take into consideration. Sometimes we do kind of that one size fits all approach, and it doesn't work. It doesn't work for everybody. So it definitely has to be tweaked and applied to that individual for sure.
Now, N-acetylcholine, well, and is it
NAC, yep, that's right. N-acetylcholine.
Oh, okay. Oh, cysteine.
You were mixing the glutathione together.
Yeah. Whoa. Hey, that's an idea. But
exactly.
We're always willing to invent things that are going to help. That's a precursor to glutathione, right?
Yes. Yep. So it's with phase 1. Some of the people, lots of times, will like doing the liposomal glutathione because it's like the end phase if somebody has issues with like conversion. But NAC is more related with like phase 1 of the liver. So you might want to start off with that. I like liposomal glutathione because it does phase 1 and phase 2. So it kind of covers both. The taste isn't great, and then I have some people that even when you I don't like to oftentimes detox right away in the beginning, because a lot of people don't feel well detoxing right away, because their systems, if you're constitutionally not strong, especially like, let's say, even if you have like a patient with autoimmune condition, you don't want to start getting their body to drain and detox right away, because you're just not strong enough to maintain that. So you have to kind of find out what that fine balance is too.
Yeah, that's hard unless you start trying, right?
Yes, exactly. You'll know pretty soon in terms of how they feel based on those responses.
Yeah, because I've heard so many times that people say they're starting antibiotic therapy, and they're like, ooh, I think I'm starting to feel better. And then within a couple of week period, they're back on the couch and they're really, really sick. Mm-hmm.
Yes,
that's
and
hard.
And the other thing is what you said with that is that you're also taking a high dose of probiotics. So I've had that with some of my patients that have been on antibiotics, and either they weren't recommended to be on a probiotic, or the probiotic amount is too low, or they'll start getting things like yeast infection. So you want to make sure the probiotic you're taking is like 100 billion, like it's a very, very high dose, at least 100 billion. Also, we'll look at things like Saccharomyces boulardii, which is more helpful for candida. Some people, it doesn't work well for Saccharomyces, but we might add that in as well. So sometimes people will not feel well because their body, their gut microbiome, like we talked about, is affected, and they're not able, to eliminate as well. So the high dose probiotics helps with that elimination as well.
The espilardi, is that something you use prophylactically?
Yeah, so we'll do Saccharomyces boulardii is just another type of not anti-probiotic, but it has a more affinity for yeast and like candida and things like that. So I'll often do that, because you'll see a patient that's on, only for my patients that are on antibiotics we're on it for a long period of time, just because they're more susceptible. So we'll do that definitely as soon as they're on one. But in terms of the patients I work with that don't have antibiotics, I'll also put them in general on, probiotic. I might rotate with a spore-based probiotic. I might rotate with a Saccharomyces boulardii. So we'll do a rotation, but initially I kind of will do a high dose of the probiotics.
Right. Now, people come, they've been on antibiotics and you're checking, do you do an oat test or a stool test to check for the gut microbiome?
Yeah, so I'll usually do the oat test, or not oat test, I'm sorry, the stool test. I typically will, they've had pretty serious GI issues. I'll look at the stool test ×3, where they're actually getting 3 stool samples because unfortunately, a lot of my patients might have GI issues where they're going to the bathroom, let's say, frequently. So you want to make sure in those cases that there's like a 3-time stool test. So you're getting the full spectrum. So we'll look at that. There's another test that I love also called GI mapping, which is another one too that also gives some good information. OAT test is great. Usually I don't begin off with that. I would look at potentially a stool test as well.
So, people who end up having a lot of yeast problems, I'll quantify it in a yeast category. How do you like to treat that? Because I'm really thinking about that balance. I mean, do you really go after the yeast, but then make sure you're balancing the good bacteria? I mean, how do you balance that?
No, it's a good question because it is a good question. Because I have patients that come in that's like, well, they have Lyme, they have Candida, they have mold. It's like, well, where do you start? What's the biggest, where is the pieces that you start? So I always try to first build the person up. If their constitution's not strong, so that it depends on the actual constitution of the person. If Candida has been like an issue for a period of time, then I'm going to address it. If it feels like it's kind of new, I might wait a few months before I address it. But if it feels like that's been something they're struggling with that hasn't fully resolved itself, I might actually try to do something about that. But typically in terms of like Candida, oftentimes oregano is one. So a lot of actually also MDs and naturopathic doctors will do oregano. Oregano is one of the common ones to do in conjunction with either antibiotics or herbal protocol. So there's things like oregano that you might want to use to begin with a certain amount of drops. And then I'll look at the Saccharomyces. There's a lot of different supplements like olive leaf extract, like combination ones as well to help with Candida that you might be on for a period of time.
Yeah. How long do you think?
I usually have people on it for like 6 to 8 weeks. And then if we're looking at something like mold, I'll do 6 to 8 weeks and then I'll follow it by a binder. Some people put people on binders like from the beginning. Personally, I mean, for some people it works really well. Personally, I have not had good results when I put people on binders in the beginning. I like to try to make sure I get stuff kind of moving and then at the end kind of putting them on something to actually to bind and remove things out of the system.
Well, moving is number one, right? You got to make sure they're pooping.
Yes, and some people aren't moving well, so when you put binders in them, it could either aggravate their stomach because, again, their GI functioning isn't strong, or they feel worse, or, I've just had a lot of consequences from that. A lot of people do it all the time. They don't have those same things, but, I guess every clinician has their own experience, and so that's what I base that off of.
Yeah, that's a very difficult thing because, they're not feeling well already. Then they're, you're tinkering with their system and you can put them in a negative. I mean, how long do they feel lousy before you say, oh, maybe we're pushing them?
That's a good point too. If someone is not feeling well and it's really past like 2 or 3 months, you really want to consider, like, is that first step you made the right step? If you're seeing a person that's aligned with their doctor as a patient, in terms of the audience I know that's going to be listening to this podcast. And for doctors, I feel like when it's 2 to 3 months out and the symptoms are either the same and they're not, are the same as when they first came into the office, or if they're getting worse, you have to consider, are you kind of going down the right path? So for some of my patients, mold might be more of the issue. And so I might need to have worked on that. Or for some, it's their immune system is just really weak and got compromised. And so I need to build them up. So it really shouldn't be, and unfortunately, I hear that a lot. It shouldn't be that you're on a protocol for a year and you feel the same, if not worse. Sometimes it's a good sign if you get a bit aggravated in the beginning because it's meaning your body's immune system is starting up, or you might be herxing like, or it's, it's the spirochetes are active, it actually indicates that. However, if it's, past, I would say 3 months, and that's when you want to say, is this the right kind of approach? And do we need to take a different look at this or approach it in a different way?
So if you're treating with oregano or olive leaf, and we know it's helping
Mm-hmm.
candida, etc., is it also helping for mold illness too?
Oh, yes, yes. So it has been used for that. Lots of times I'll look at other glucomannan, some other fibers to pull. I'll look at things like chlorophyll to begin people off. So I'll look at glutathione. I kind of put people on, and also minerals and things like that to support people. But those might be things that I set people up and then with in terms of like those antifungals. And then after like 6 to 8 weeks, then we'll look at binders to help remove. And it's great because what the good thing is with a lot of these functional tests, you can do a pre and you can do a post, and you can actually see the difference in their numbers going down. So that's always, a great thing for patients to see. For mold, we'll look at, there's specific mold testing companies that we work with to be able to check for that as well. A lot of my patients, unfortunately, I'll even be able to see it in blood work. So I'll do like Aspergillus fumigatus, and they'll have that. That might be like an initial first step if you're a patient or you're looking at mold, is to do it through blood work. But the other tests are a little bit more specific because they're going to show all the different types of mold, and it also will pick up information before it becomes as high enough that it's in the blood itself. So,
Do you see more mold from food sources or environment?
environmental.
Or
For
both?
me, I've seen both, but I see mostly, I am in Connecticut and New England. So I do see mostly, I'd say environmental. And I'll have patients where like, when I go into the basement, I feel they'll know clearly as soon as they get exposed. And then also when the weather changes, like it's rainy, I'd say a month and a half ago, some of my patients that were doing well, all of a sudden like, "Ooh, I'm not feeling good." And it's usually because of mold, because of the rainy weather and just the picking up of mold or kind of prime mold season, which is typically in the fall and initially in the change of season. So for me, it's been mostly environmental, but there are foods that, almond, nuts and like certain, or I tell people to be careful wine in terms of, what they are held in and things like that, that can maybe expose them to things that they're allergic to or sensitive to. So, but for the most part where I am, it's primarily environmental.
Yeah, I hear a lot about coffee.
Yes,
Um,
that's another one. Yep. That's another
it
one.
really, that's so upsetting because who doesn't like to go off to their
Exactly.
favorite coffee shop? And what do you say to them? Hey, are your beans moldy?
I
What do you
know.
do? People don't have a clue
Hmm.
about that. That seems so far-fetched,
Yes.
I mean, obviously when you open up your container of something you've had in the fridge for a while and you see some white speckles or some
It's
green
pretty
stuff,
clear.
yeah, it's pretty clear that
Now
is
it is a good point. Coffee is always the coffee and alcohol. Are the two things my patients do not usually want to do away with. It's typically one or the other. It's like one they can do, but the other one is like no. So it's interesting because as part of our protocol with the patients that we work with Lyme disease, we'll oftentimes put them on like what's called an alkaline diet, or we put them on autoimmune paleo diet is another one. But basically foods that are less inflammatory. The alkaline diet is great for Lyme disease because it makes your system it's more specific to having the pH more balanced so that you get less of the aggravation. Because with Lyme disease, it thrives and gets worse with lactic acid. So you'll see like someone that exercises, after they exercise, they're like, oh my gosh, I feel great during it, and I need to go take a nap after. I feel horrible. And a lot of it, I can see you shaking your head, you've heard that. So, and a lot of it's because it's like you're exercising intensely. So there's that lactic acid buildup. And so it makes you worse. So there's options for that. We'll look at things like Alka-Seltzer Gold or things to kind of make you more alkaline. But having that diet is really helpful. And the reason I'm mentioning that is that foods that are acidic, actually coffee is one and alcohol is one. So sometimes I have to talk to patients about, not either eliminating or decreasing it as much as possible. I know coffee is typically a hard one because it becomes such a routine and habit that people, including myself, do not want to, take away from. So it's kind of like we try to do it where you're first decreasing it until eventually you could start phasing it out.
Have you ever heard Dr. Jill Carnahan
Oh,
speak
yes,
at all?
yes.
Oh, if she is like coffee and chocolate. If you tie her up and you put it in front of her, she'll break the chains to get at it. She is
Oh, I
like,
love that.
oh, she will. She's aggressive when it comes to those two things.
And coffee does have, I mean, there are health benefits of
Yeah,
coffee if
yeah.
it's black. Most people don't drink it black, though. You do
Oh,
it with what, milk and all the other things. But
I
black
know.
has been used as an enema, which helps your liver. But I do have people, when they get off of it, will feel a lot better. Or I just had one patient like totally addicted to it, and he couldn't believe. He's like, "Oh my gosh, I got off of coffee. Like, how did I do?" Because it's like 5 cups a day. The interesting thing is, he said his energy feels amazing. Like, he feels like he didn't realize for him, and I have that with a lot of patients, like that coffee made their stomach feel upset or they felt bloated. Like, you just kind of start taking those things for granted or writing them off. But yeah, I'm a coffee lover too. I love that about the chains, though.
You've got such white teeth, so that's really that's a good sign. Are you sipping? Are you sipping out of a straw? Gotta be careful.
I didn't get addicted actually into it until I worked in New York City. I didn't even drink it through my medical school. I worked in New York City, and they had Dominican coffee, and that's where I got addicted.
Ooh, wow.
That stuff was some strong
wow.
stuff.
Italian coffee is awesome as well. That's really very, very tasty. And we were in Italy years ago, and actually took some espresso beans home. And when I ran out, I was so upset. So I went online. I went online and I found it was super cheap. I was like, look at this. It's like less than $10 for all of this. And then I put it in the cart and I went to, pay for it. And I found that it was like $35 or $40 to get it shipped. I'm like, that's not going to happen.
$4 shipping. That's where they get you.
Yeah, they get you. They get you. You talked about Alka-Seltzer Gold, and what are other ways you can kind of get yourself out of a real cascade of inflammation?
Yeah, so Alka-Seltzer Gold is great, when you're herxing. One of the other things we use in our office is something called trisalts, which are like alkalinizing salts. The other thing is, you want to be mindful if it's like exercise that aggravates you. I'll tell my patients to just build up. So you don't want to do, I'll say, let's do 15 to 20 minutes. Don't do it in a state where you're getting like a, basically like anaerobic. Weightlifting, even I have some people weightlifting bothers, but weightlifting technically is anaerobic, but it usually doesn't get your heart rate to the point where you're going to start producing a lot of lactic acid. So I'll initially tell people with exercise to just kind of build into it slowly. The other things in terms of making them feel better, far infrared sauna is a great one. I will tell patients to initially, if they haven't had one, there's a lot of places where you can go do a far infrared sauna for a couple of times a week. Usually it's 2 or 3 times a week. But I'll say if you're doing it pretty frequently, you might want to get like a portable sauna at home, just because the price can add up. So I usually tell people try that for a month to see how they feel. But far infrared sauna is a great way to help detox. People will feel immediately better. I usually tell people with Lyme not to really do it for more than 20 minutes initially, to just see how they do. Also, all the dietary pieces, you want to keep mind of as well. So those are the initial steps. In the Cowden protocol, what we'll do is we put them on specific herbs that help with the detox pathways. So there are ones, and so usually those support the liver. So we'll look at other liver supporting things that will just help so that they're less aggravated and making sure things get processed efficiently.
How do you decide if you're going to use Cowden or Bunner, or do you? That's
and Byron White,
one.
And we have a lot.
Yeah.
And some of them we find are maybe stronger than the other. I found really good success with our modified Cowden, so it's not the full Cowden protocol. But how I decide typically is, the sensitivity. Like if I have a patient that's like, I've done everything. I've done Dr. Zhang's protocol. I've done antibiotics for years. I've done Cowden. They've done everything.
Oh.
Those people, I'll say, okay, let's do low dose immunotherapy, because that's something most people haven't done. And that typically is working more on that autoimmunity piece of like making it so that you're what they call Th1 and Th2 for your immune system are more regulated. I oftentimes won't do that in the beginning, but if someone is like, they've exhausted all things when they've seen me, we will just start off at the beginning, because they might get a little bit of a flare sometimes when they first start that. So I'll look at that. So it really depends on what the person is coming in with, of what they've done, or someone's like, oh my gosh, I'm sensitive to everything. I could have that patient, and then I can have the other patient that's like, I've done everything and nothing works. So it really depends on that person. Even like deciding on the drops, I might decide 2 drops for a person. I'll have 2 drops for an individual that's like, let's say 250 pounds, and they'll be a man and they'll be knocked out. And then I'll have a kid on like 15 drops and they're fine. So it's so person dependent. And so I really try to get an idea of like their history and how they typically respond to make that decision.
Some people are misdiagnosed in the realm of like MS and
Mm-hmm.
ALS, and it's very, very hard because a lot of people start off with their primary care, then they're go off to a rheumatologist or to a neurologist, and as soon as they see particular signs, they go down that path. How is it that it's decided, other than really testing positive, how is it decided that it's it's truly a Lyme condition and really not a diagnosis of MS or ALS?
I think that's a really good question, because you do want to, especially if the progression of like neurological symptoms are worsening, that you want to make sure, that part is fully evaluated. I think MS is the one that is the most tricky. It is just for people that don't know as much about it, it's an autoimmune condition that attacks the myelin sheaths. So the symptoms you have could be like motor coordination issues, fatigue, because since it's autoimmune condition, most autoimmune conditions have what in common, like energy, fatigue, body pain, those types of things. So a lot of the symptoms are similar. And the tricky thing with MS is they'll usually do like an MRI to check for plaques and things, but even that's not like 100% definitive. Sometimes they'll look at a spinal tap. So with ALS, they'll do like an EMG, that's more definitive, and a spinal tap to actually confirm that. Obviously, people don't want to go down the spinal tap route. Unfortunately, lots of times those patients may or may not have been checked for Lyme disease as part of it. And I definitely have had those cases where I've had a patient with MRIs and they've had plaques and they were going down the road of potentially having MS. And then I've worked with them. We put them on protocols. They've actually done repeat MRIs and those plaques and things are gone. So I've actually had that in terms of results with patients, which clearly indicates that was Lyme disease because we put them on a Lyme protocol. So it kind of could have prevented them from having that progression. There is some studies and information to show that multiple sclerosis, MS, and ALS can be a progression of Lyme disease in terms of like stage 3. And stage 3 Lyme disease affects more the neurological, has that neurological effect. So yes, there is definitely information about that, but I know those initial diagnosis, MS and Lyme, is a little bit confusing or not clear, I think, when you're going the conventional medicine route.
Right. People can end up on prednisone and
Mm-hmm.
biologics and things like that can be really, I think, be more detrimental.
Mm-hmm.
Autoimmune, again, Lyme being that great imitator, people can end up with autoimmune markers for thyroid, for rheumatoid. How do you handle that if say their Lyme test, they're one of those people that their immune system's compromised, they're not making it? Do you just do some different type of testing where you're looking for, instead of antibodies, you're looking for additional markers?
Yeah, so I usually will, I definitely do that. So when they first come in, I might check for like ANA, which is an anti-nuclear antibody. That one's connected with lupus, also rheumatoid arthritis, also Sjogren's, so that covers a few. The Smith antibodies, I might look at anti-DNase in terms of antibodies. You want to look at, and then for Hashimoto's or Graves' disease, the thyroglobulin antibodies and TPO. So there are different ones you want to look at. The one interesting thing, though, is Lyme will, because if your body is inflamed and you have antibodies, sometimes it could raise antibodies in other immune markers. So I will have patients that their antibodies for like their ANA will be up, but they don't really have all the classic symptoms. ANA is mostly connected with lupus. They don't have all the classic symptoms with lupus. You have to actually have 4 of, I think it's 10 symptoms. I know it's 4. I think it's 10 or 12 clinical symptoms. So oftentimes they might have like 1, but they don't have the others. And also 25% of people just generally might have a high elevated ANA. So what I'll see is like when their antibodies are up, it'll increase the antibodies, the other things. And as they get better, those will go down. So it's clearly connected. Also some of the, like, we talked about or I think you mentioned retrovirus HSV, or like we're looking at Epstein-Barr. That comes up a lot that I check for patients, and you'll see Epstein-Barr. There is something to what's called molecular mimicry. And so these viruses mimic other, like let's say autoimmune conditions, or something like Epstein-Barr might tick up, like if it's out of control, might flare up Lyme disease. So Epstein-Barr has been connected with Hashimoto's if there's elevated levels. So to me, it's always really good information to have, because now I know when I'm working with the patient, I might need to look at, okay, are they going down the path of like autoimmune condition? That's kind of what I love about, naturopathic medicine and functional medicine, is we're often getting potentially people before, that phase happens 10 or 20 years from now. And so to me, that's all good information to show kind of like how their system, what kind of disease conditions they might be more likely to have than other people.
I'm picturing this umbrella, say, with spokes. And at the top of the umbrella is all these issues that this poor one person is dealing with. And then their symptomatology. And then you have to make that decision of where you go first. We didn't talk about micronutrients. How beneficial are micronutrients and your minerals and things that really...
Oh, definitely. That is something I'll often put people on in the beginning. So if like I'm just working with you and we're getting all the test work and assessments and figuring that out, I'll initially put people on things like the minerals, because most people are depleted. I think, for example, magnesium, it's like 85% of people are depleted in magnesium. But whatever doctor you see, our practice definitely primarily focuses on Lyme disease. However, sometimes we have patients that come in, like I mentioned, I work them up and I'm like, there's something else might be going on, and they might have a different condition or autoimmune condition. So you want to make sure as a practitioner too, you're always open, because sometimes it can come where you're thinking everything is connected, and Lyme honestly does affect tons of things. But you want to make sure, I've had patients where I found physical findings, and they had like vascular issues, and it's like, oh, well, that could have caused the issue with dizziness and feeling faint and those things. And this is like a cardiac workup, and it might actually not be Lyme, but they might feel that it is. So you want to make sure like a full physical exam is very thorough, which a lot of people don't do, unfortunately, nowadays, because they're moving through things fast. I've had that definitely happen a lot, where I find a physical finding that may not have been picked up. And so you want to make sure whoever you're working with, and as a practitioner, they're just thinking of every possibility.
Yeah, because you don't want to have a preconceived notion.
Exactly.
That can be dangerous.
It could be really dangerous, because then you're seeing everything in a certain light. And like I had mentioned with some patients I've had, where it's like, oh, you're having a cardiovascular issue. Well, yeah, of course you're going to have syncopal, and you're going to be fainting, and you're going to events, or you're going to be dizzy, or you're going to like, this is, I don't know. I mean, definitely they might have that, but you need to get fully worked up on the with a cardiologist to check in with some of those things. And I know there are things like Lyme carditis, which people do get too. I'll have patients with palpitations, and they'll have those effects, but it's usually part of that whole picture. When it's kind of one thing, you want to just make sure, is this about, is this Lyme, or is it just one specific thing that's going on right now?
Do you ever get pregnant women?
Oh, yes, I do. And a lot of them are worried, can I pass that on to my children? The current information and literature out there says no, and you can't pass it sexually. However, there's a lot of new research being looked at now, if there is that ability to transmit to your children. And I have had some experiences where I've had, a 2-year-old child that will have, let's say, Rocky Mountain spotted fever, and they're Connecticut. So that's uncommon, but their mother had it. So to me, that shows me some information about, where would they have gotten that from at the age of 2, when they're not in an area that's exposed to it and their mother has it. So I know that there's information out there saying that is not, but I would say clinically I have seen those few instances, and but it's not 100%. I also don't want women to get scared that, because I've had some women scared of getting pregnant now. Oh no, I don't want to pass this on to my children. I wouldn't say, there's so many things to be able to do to help support that. So I wouldn't make that decision, but there is, I think the information is still being researched and looked at though.
Do you have any testing that you do to determine if either the viral load is low enough, or you can't find any indication of Lyme or co-infections,
Mhm.
and then at that point you start weaning people off? I mean, we know things hide in the tissue and et cetera, but is there any particular testing that you like to do to see things are resolving?
Yeah, so typically I will, and you're right, there is, it could still be in your system for a while, even if it's clear, people will still maybe have some of those manifestations. Because in my opinion, it becomes almost like an autoimmune condition where your body's just started attacking itself, that stimulation. So typically what I do, it's hard to find out if it's active or not. There's no real clear, I mean, there's lab work out there to be able to check for that, but it's not always clear whether, even when you get tested, if it's active or not. So sometimes you have to go by the symptoms. I have some patients will have Lyme antibodies, and then all of a sudden they're feeling great 2 years, and then all of a sudden they're like, oh my gosh, I'm having the same symptoms I had like 2 years ago. And I might test them and it shows that it's like acute infection. So you have to say, like, you have to weigh that out. Your IgM, for example, can go up in general because you get sicker, or you get sick, or your immune system is compromised. But you could also have gotten reinfected, like it could have also happened again. So you have to also think of all those pieces as you're looking through the cases. But typically what I do, even if a patient has come in, has done some lab work, I'll usually do something called like medical diagnostic labs is one lab vendor. I know IGenics is another lab vendor. The reason I like my medical diagnostic labs, MDL, is because it's covered through insurance. That's one of the reasons why I use that pretty frequently. Galaxy is another one that people are aware of, and Galaxy is kind of known for its work specifically with Bartonella, which is a common co-infection with Lyme disease. So I will usually test people in the beginning, and then I'll test them as soon as will be 6 months, but I usually try to wait longer, but typically around 6 months, to see if their antibody count went down. And for the most part, most of my patients, their count has went down. Again, it's not conclusive, but I've also had people where their counts actually is the same or higher. I've even had people with infections, but they feel amazing. I'll see. So it's good information. It's just, it's not always 100% consistent. I'd say for the most part, most of my patients will go down in terms of their antibody load when I'll do the recheck. But I have had some patients where they're feeling amazing, and now Bartonella shows, which it didn't show in the first time, or their antibodies are the same. And I'm like, are you sure you're feeling okay? Their numbers are really high, but they feel good. So it could just be their body is learning to adopt and manage it, and it doesn't affect them. Because you do have patients that, like, I've definitely tested some patients that have no symptoms, and they're testing because their significant other said, oh, let me just test. And they're completely positive, like 10 bands positive, like double the number that you have to have, and they have no symptoms. And so those people, I just think, well, they just need to be constitutionally stronger. Their body knows how to adapt to having it in its system without affecting them negatively.
Yeah, so those people you're primarily just needing to support.
Exactly. So what I'm doing is, like, those kind of people, like, okay, let's make sure your constitution, your immune system stays as strong. And so we might just do general things, like you just talked about nutrients and, minerals. And we might just say, okay, let's put you on something for chronic immune support that's safe to take. And, like, how do we just and also, like, lifestyle and diet. So we're going to work more on those gentle things. Those are the things I usually have people, like when you said transition, after people are asymptomatic for 3 months, I start transitioning them out of a protocol. A lot of our patients come in, they've been on protocol for years. I personally don't believe in that. I don't think that's sustainable. If I'm working with somebody, that you're going to be on these things for 10 or 20 years. So my goal is, like, after you're asymptomatic for 3 or 4 months, I'm going to start decreasing you, and I'm going to put you more on, like, that lifestyle management or immune support and minerals and those things that I talked about, that I would put with somebody on that's just constitutionally stronger.
I find that people's adrenal glands suffer
That's It's true.
horrendously. And, when you're fighting an infection, your body's stressed, then, your mind is stressed because you're like, am I going to, when is the end of this? This has been horrific.
Mm-hmm.
How do you assist the adrenal glands?
That's a good point, because so we'll usually do, like, a blood test to do AM cortisol or PM cortisol. So that's a good starting point, although it doesn't give as much information as when I do a salivary. So I'll usually do a salivary cortisol ×4 or ×5 that checks what their cortisol is throughout the day. The other tests I do in that is DHEAS. You want to make sure it's DHEAS, but the reason that's responsible for a lot of your androgens in terms of your hormones, but it's something when your adrenal glands are weak or when you run out of your stores of cortisol, your body will kind of tap into. So when your DHEA is depressed, oftentimes it's because your body you've been under a chronic state of stress. And so you might need DHEA supplementation. And then also we'll look at, it's called salivary IgA, which is it's an immunoglobulin, but it's more specific to the mucosal lining of your gut. And so you'll see for somebody that has chronic infections, that might be lower because it just compromises their microbiome. And so those are all good things that are usually included in those salivary tests. So you're right. I actually do that a lot. Typically about 3 to 6 months in. I always try to be mindful of how many testing and how many approaches we have with patients, because they could end up being on 30 supplements. So lots of times I'm trying to work on the Lyme and those pieces, but you're right. The adrenal glands is a huge piece that could have been compromised just because of the stress of it all, or just because of the infection itself, just making them weaker. So there's really, really easy protocols if a person has low cortisol or high cortisol. Also sleep is often affected. So when you can get that in rhythm, their sleep is a lot better. And honestly, sleep is also one of the top things. If a person comes to me and they're sleep isn't number 1 or number 3, that's when sometimes the Lyme, the first thing I'm working on, because if you can't get sleep, that's your body's time to heal. And it's also your body's time for your immune system to get stronger. So if you're having Lyme and you're put on protocols, but you're getting 3 hours of sleep, it's going to take you a really long time to heal, or you're probably not going to heal. So sleep is a huge part of just the healing process. And if that's not taken in consideration, it should definitely be so.
Are you a big melatonin lover?
I do. I usually wait. So melatonin is the reason why is I want to make sure they're actually low or that their cortisol is off. So I want to confirm that first. I usually look at the ones that are more slow released over the night. The challenge is if you take melatonin too long is you're getting it exogenously. So your body gets really smart and it's oh, I don't need to produce as much anymore because I'm going to get it every night I'm going to get it every night at 9:00. So I'm always weary of I'd like for your body to start producing it naturally. So typically I'll put people on herbs like passion flower or valerian, kind of calming herbs to help them go to sleep first. And then I'll do the melatonin. But I try to I'm not anti it, but I'll try to hold a little bit and see if I can do it a little bit gentler first before and support their adrenal glands where they're exercising heavy in the morning or doing a lot of activity in the morning so that by the time the night hits, they can sleep more. So I try to look at more the lifestyle and those herbs first, and then I'll do melatonin.
Yeah, that's hard. I'm going to shift this to you.
Mm-hmm.
I've never done this before, but I'm thinking about this as I'm taking care of more people with chronic illness. We have a hard task, and our task is the stress of trying to get someone to feel better.
Mm-hmm.
And sometimes patients want to shoot the messenger. And it's very hard to support people sometimes, especially if we're stressed or tired, because people want to feel better.
Mm-hmm.
They've been feeling so lousy so long. And I have to say it's hard sometimes for myself to keep up the faith. You got to keep on going. You got to, because sometimes you have to stop.
Exactly.
So for you, do you find that very stressful in your practice?
It is. And I think I understand because I myself, and I'm sure you've had your own, we've all had our own personal health struggles. For me, I remember in school, it's I went back, I tested, I was positive for Lyme and Babesia, but I didn't know when I was in school, falling asleep everywhere, joint pain, body pain, did the same exact story, went to a rheumatologist. And the thing is, I have a family history of lupus. So my ANA, there's some genetics, so it made sense that they would go down that route, but nothing was turning up. Anxiety, all of these types of things. And I ended up doing just a lot of self-care, herbs, things like that. It wasn't until later that I got tested and I was oh, that's probably what all those things were. but you feel like you're going mad or crazy, and like, why are you not feeling good, or why are you exhausted? Why can you fall asleep sitting on a bench? So I think when I'm working with patients, I remember that. And I also, share that, like, I get it. And that also just letting them know, I'm here with them. I think that's the biggest thing. Like, I'm part of this journey, and I truly want them to get better. It's not about my ego. It's like, I really want, especially I think the hardest are people that are, I feel like, under 30, because it's like they're taking off with their life. So those always, sometimes some people, it hits me the most, because it's like, oh geez, you're out of school, you can't be in college for a year, or you're doing ports in your 20s. Like, how are you doing? So those things, sometimes it's hard to take those stories, not personally back home, of that like mission of like, I'm going to get that person better. So I think for me, that's one of the reasons why my schedule, I have like an hour and a half block in the middle of the day. So I can kind of like, because I want to make sure when I'm with patients, or 2 hours actually, I do some admin, but I want to make sure when I'm with patients, I'm like present, because it could be really hard, as a provider, that you're just seeing people, and it's exhausting because you're dealing with really hard cases in people's lives. And I just take that responsibility really high. And so I have to do those kind of like, okay, I need a break, and those checks in the middle of the day, that just helps me to kind of like reground, recenter myself. And also like how I plan my morning, making sure to do, I call it like a power time or power hour in the morning, to kind of, and check my schedule the night before for 10 minutes. So I'm kind of like mentally prepared and knowledgeable and ready. So that's those are some of the things like personally I've done to kind of like balance that out. But I think just making sure that patients know that you're in it with them and you're partnering. And if you do feel like there's a higher level of care needed, you're connecting them to that too as well. Sometimes you have to do that. The great thing is my team, at my office, there's 6 of us. So the great thing is we can sometimes bounce back on cases. I think sometimes it's harder when you can't do that, but that does also provide a sense of relief, and also support for our patients, because they know there's like a whole team behind them trying to help make sure that they're well.
What does your 6 member team consist of?
So there's 4 naturopathic doctors, including me. I also have a nutritionist and physical therapist, and I have an internist, an internal medicine consultant, because in Connecticut, naturopathic doctors were not able to prescribe, which I'm kind of, I definitely think we are trained and we're knowledgeable, but it's all depending on the state. So if I went to Vermont, I could prescribe. Part of me, I definitely want us to have full rights, because I think it helps patients, because it creates an extra step for them to have to go see the provider. But on the other side, it makes it hard. You have to do it in the full way. So we have that, and then we're looking also to add a therapist. So this way we have that whole full picture, and obviously a therapist that is literate in Lyme and chronic disease, because that's also a picture for a patient that, like, it doesn't mean there's something wrong if they have to go to a therapist. This could be part of that, needing support after they got this disease. So having a full team that's kind of the model I've tried to create, because it's just important to me to address those things that you asked.
Yeah, I'm real excited because I'm in the spring. I forget where we are. Geez, Louise. Spring of 2020, I'm opening a wellness center.
Ooh, wow.
So yeah, so right in East Long Meadow. And what's nice about it is I've got a couple of therapists. One that deals with trauma, which illness is really a trauma. Mm-hmm. We've got massage, lymphatic drainage. We're going to do some therapeutic yoga. I'm looking at a couple other practitioners, but I see this gamut, and we're going to be doing therapies for assisting with detoxification, like far infrared sauna. I'm hoping to have a meditation room with a far infrared mat, and the biocharger doing, it's very similar to pulse electromagnetic therapy, PEMT, but it's with a different harmonic. It's with a Tesla coil. And Tesla is not the car.
I was going to say that's what people are thinking.
Yeah, not
to that center.
Yeah, hey, that would be cool, right? You get in the car, Tesla, you take a drive around the block, helps you detoxify.
Far infrared sauna and Tesla.
There you go. There you go. Wow. This is great. First of all, it's a wonderful preceptorship for me. I hear so many angles in which people go after chronic illness, and I resonate very well with what your protocols are. And I think the most important is these people who are not feeling well should not, if they're not getting anywhere, then they really need to step back, take a breather, and find a practitioner that really is ready to assist them.
I agree. And that's what I say is like, and if there's a certain period of time, that's what I would say is like 3 to 4 months, no more than 6 months. You have to consider, even as the practitioner, you know, if like someone's not, you have to kind of, again, it's like put your ego aside and say, okay, what am I not doing? Or am I the right fit for this case? You know, because that you have to, I mean, that's my obligation, is that people are well, however they're getting well, you know, so that's just how I see the things. And that's what I love. I'm glad that you're doing that wellness center, but I feel like part of it is that there's a whole picture of a person. You know, we're not just one thing. We're not just medication. We're not just, you know, Lyme disease. We're not just, there's the whole like mental, emotional part. There's the physical piece. There's a lifestyle. There's so many pieces that make up who we are. And so sometimes you might also just resonate with a person in a different way, or they see a different perspective that may not have been picked up. So you definitely don't want to feel stuck. Which some of the people feel of how they are in health. Like you should truly get better. Like you should never lose hope in that.
Right. And outside of the physical center, we have assistance virtually. I have my daughter's a registered dietitian and a functional dietitian. I'm hoping to have someone who maybe is a lifestyle coach. What happens with all of this, though, is, you know, it's a financial commitment to people, and they have to really think about what was the financial loss prior to this and what's the financial loss going forward if they don't get better. And I think that's just an important part of healing.
Yeah. And that's the hard part. I've had patients that have come to me that have already spent $50,000 or $100,000. And, it's, you know, desperation. They're coming in and it's like, I need something now. I need to be better now. And it's like, whoa, you know, it's like, it's been 10 years, you know, there's a process. So I think also patients have to be patient with that. But of course, just like I said, it shouldn't be 3 to 6 months where you're feeling still bad. Yeah. But you also shouldn't expect a one done deal. Like I come in, I see them, I'm going to be back to myself in a month. Like that's not, it took you a long time to get there. So it's not.
It's not a case of pneumonia,
exactly.
You know, or a strep throat. Then in 48 hours on the antibiotics, you're going to start to feel better. This has been great. I know it would make everybody's life so much easier.
Exactly.
But this has been an awesome interview. And, you know, with your abilities and your knowledge and your leadership, I can only hope that you are making an impact on mainstream medicine, because the pushback and the issue with that is very, very difficult for people who are getting in that functional space, especially like, you know, for myself being, you know, a general Western medicine lady and, you know, looking at what I did as a gynecological provider, and it's a big shift, and you know, so.
And that's why I'm always going to be active, probably in the leadership and policy, and because it has to change. I really feel like this is where the care should start. It's like even our internist says in the office, she's like, I feel like naturopathic medicine or functional medicine, that's like where it should start, and then these other things go later. It feels like it's the reverse. Like people have done all of that, and then it doesn't work, and then they come to the alternative, you know, a different approach, but it really should be kind of the bedrock and the foundation initially.
Right. And, you know, there's been talk that this space is going to be the future of how people should be cared for. Right now, I look at it as a kind of like this little slice right now, while we're trying to educate people all around us to say, hey, you know, here's some approaches. You know, I talk to people who are on statins, and their doc who's taking care of them has no clue that their CoQ10 is gone.
Oh, yes. Yeah.
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 Yeah. And that you really need to supplement with that, you know, or I'll talk to people about it and say, hey, did they ever talk to you about that? And then they look at me like, no, but my doctor's really knowledgeable. So I'm not going to listen to you. I'll just listen to them.
Or they feel nervous to ask.
Oh,
I
yeah.
think that's the thing is I'm like, you should always feel empowered with whatever, and you know, that whatever provider you're working with to ask a question. And if you don't feel like you can, or if you're just shut down, then you need to look at a different provider. Like it's like you're the, and I always think you're like still the customer, you know, like you can't have it where you're feeling like you're not able to ask a question. It's your health, it's your body. So like make sure you speak up. And if you're not with someone that allows you to do that, then you have to look for somebody else. So.
Yep. Yep. It's really, you're walking in your own shoes and you really have to be your own advocate. Well, I'm so excited that I got to meet you, Dr. Patterson. And I just want to let everybody know that your group is in Fairfield, Connecticut.
Yes.
And
Fairfield Family Health is the name, and our website's fairfieldfamilyhealth.com.
wonderful. And they can find you there. And hopefully, you know, with your team, I think, you know, there is strength in numbers. And when you do have, because, you know, we can't remember and we can't know everything. And when we can go to somebody and say, hey, have you had this kind of experience? And they give you the input, you know, it
is helpful. And then also with our naturopathic doctors, they all have different specialties. So one's like women's health, one does more cranial sacral, one is actually has her master's in acupuncture, but she is more of an interest for like geriatric and Alzheimer's, or those like, you know, complicated, there's some of those complications. So it's good to be able to get that, even Chinese medicine perspective, you know.
Wow. That's really great. Well, thank you. Thank you again.
Thank you for having me. It was wonderful talking to you.
Yeah, we could do this all day, I think.
I know.
Well, everybody, you've listened to Dr. Jaquel Patterson from Fairfield, Connecticut, and she talked to us so much about Lyme. Really appreciate that, because it's all about you guys out there and making a difference in your own health. So till next time, come back and visit. And between now and then, go ahead to the website, www.livingwithlyme.us. Make sure you're subscribed so you get all the information and when a new podcast is being released. Until next time, everybody, enjoy, be well.
Thank you.
Get well.
Thank you.
You're welcome.